Hello, Theodora here, all-round Bobette, dental hygienist and therapist and creator of the Bob Methods. I hope you have all been enjoying Bob so far, and if you haven't yet, well, it's time to start. You're missing out on some serious patient success stories, and not only that, but your own personal success story. You see, Bob has been created not just for your patients, but for you as well. And I understand how it feels as a hygienist who wants to make the world a better and healthier place by attempting to change and improve the oral hygiene of patients. Yet, it can always be a bit of a struggle with many factors involved, and it's true, you too can become a little bit deflated, disheartened, and stuck in a time-pressured routine, which is a vicious, never-ending cycle. I get it, I've been there. Well, now I'm here to help you mix things up so that you can start loving what you do again, so that you can feel passionate, re-energized, re-motivated and excited about oral hygiene and prevention. However, I can't do all of that by myself. As much as a mentor I can be for you, I have to have a little help from my friend Bob. So stay tuned and enjoy watching the new instruction videos so that I can further help and guide you to the best possible method in which to use Bob in practice. I have been asked by many of you time and time again, but how do I use Bob? How do my patients and I benefit the most? And how do I choose which patients to use Bob on? Well, I'm here to say there are a variety of exciting and engaging ways, so please don't ever feel that you can't use Bob on particular patients. I certainly have. I've used Bob in all walks of life, and I'm here to tell the tale and method for each. That's why I created the Bob Methods, to support you, my fellow dental professionals, my Bobettes and my Bobbers. So coming up are some helpful instruction videos on how to really implement Bob so that you and your patients really do benefit most from Bob. We are going to gamify oral health together, so let's get passionate about prevention again and have some fun along the way with Bob. So let's begin with talking about behaviour change. Now, of course, there are an abundance of techniques which may aid when installing a new habit, and to dental professionals, digital health tools such as Bob can really bridge the gap in communication and behaviour change. Dental professionals are thoughtful educators and strive in advising patients of the importance of self-care, oral hygiene, and strengthen their advice by completing oral hygiene demonstrations. However, professionals are familiar with patients not completing their own oral hygiene care at home, even though how to do so was thoroughly explained and displayed to them. We also inform patients of the risks associated when their self-care is absent. So what is the reason for this common occurrence in patients not completing daily oral hygiene instructions? Could it be that although you can teach a skill to someone, that does not necessarily mean that they can or have the motivation and support to implement those skills taught to them daily? Well, that is where Bob excels, as we now have a tool that can aid us in communication and behaviour change for our patients with whom will return to us and feel that they will want to complete the oral hygiene skills taught to them by us, the professionals. However, there can be other factors involved when attempting to install a new habit. And it is important that we support our patients in the best possible means, so it feels easier for them to begin and achieve their daily goals towards the new behaviour we have taught them. Some other factors that can aid patients in this transition would be, for example, the dental office to stock all the relevant Bob interdental aids to ensure that the patient exits the clinic with their personalised Bob score along with the correct aids and quantity to last them until their next appointment with you. Also, the follow-up. Now, this is a crucial part in a patient's continued motivation and success, recalibration and support in their general health. Depending on where you are in the world, this follow-up can be completed with the assigned clinical or designated professional. Also to mention is having a combined team approach, including other members of your team in Bob, particularly the reception and front of house, as these individuals in particular play a crucial role. They are whom patients will first make contact with. Therefore, they have the power to educate, reassure, and strengthen our Bob appointments, including implementation and that all-important follow-up. Also, how about a reward system? The use of a reward system by using the Bob categories should not go amiss. Gifts or discounts by the dental professional can be provided to reward the patients for changing their habits and therefore becoming healthier. One of the 4 categories can be assigned to each patient at each appointment to further motivate them to continue their oral hygiene habits, as the act of reward is a strong factor in changing behaviour. With longer and stronger daily interdental cleaning habits.